She's the executive director of the Women's Health Center over on West Washington Street. And she was presenting at the discussion group, and I really think they could have gone on for another hour and a half. It was a very interesting talk. So she's here to present to us. She has a long history with the Women's Health Center. She started out as a social worker, she became their office manager, and finally administrator. I'd like to present to you Sharon Lewis.
What I've come to discuss with you this morning is the Women's Health Center services. And the Women's Health Center of West Virginia did arise out of the concerns for women's health. Women's Health Center is a provider of reproductive health care to women of all ages, regardless of their ability to pay. If the woman cannot pay, we provide a free service. We're located at 510 Washington Street West on Charleston's west side. We've been specialists in women's reproductive health care for 38 years. Women's Health Center came to be, can you hear me? Women's Health Center came to be as a result of the vision of Jane McCabe, who is Brooks McCabe's mother. After Roe v. Wade case went to the Supreme Court and abortion was legalized, Mrs. McCabe was concerned that poor women in West Virginia still did not have access to care because they didn't have the money to travel to other states where the services were available. So she believed that we should have a reproductive health center that would provide abortion care in the state of West Virginia. She saw abortion care as a right for all women. So Mrs. McCabe gathered up a number of volunteers in the city of Charleston and around the state, and they organized with St. John's Episcopal Church downtown and actually had an office there so that they could do the planning for the Women's Health Center. In order to obtain funding to get the center organized, they approached Planned Parenthood, and Planned Parenthood offered them a $65,000 loan. And so these volunteers actually were underwriters for the loan, and they put their homes up as collateral in order to get it.
Wow.
As a result of that activity, Women's Health Center was incorporated in 1975 as a nonprofit organization and opened its doors in 1976, offering two services. Those were pregnancy tests and first trimester abortions. Our first board chair was Jane McCabe, and our first executive director was Nancy Tolliver. Our mission is to provide reproductive health care that respects a woman's choices. We do not judge the women who come to our facility. We respect her dignity, confidentiality, and her personal values. Some interesting facts about the Women's Health Center. We opened one of the first birth centers in the state of West Virginia. It operated from 1979 until 1989 when lack of funding caused us to need to close it. We provided office space to the first sexual assault program in the state of West Virginia. And we rented buildings in Kanawha City and had several locations over the initial years, but actually in 1998, we purchased the building on the west side, and which is currently our home, and moved in 2001. Women's Health Center is a pro-choice organization. And that means that we believe that it's the woman's decision when she has an unplanned pregnancy to decide whether she wants to terminate, parent, or place the child for adoption. It means we're not anti-life. We believe women make their choices and that they should have information about all the options that are available to them. The first service that I wanted to give you some information about is our abortion service. We are the only nonprofit abortion provider in the state of West Virginia, and in the entire state of West Virginia, there are only two providers of abortion care. They both are in the city of Charleston. So women who need that service have to come from whatever point they are in the state to Charleston, We not only serve women from West Virginia, we serve women from the contiguous states, Ohio, Virginia, Kentucky. We provide abortion care about 7 to 10 days a month, and we provide both surgical and medical abortions. The surgical abortion is an outpatient procedure, and we do it from 4 to 16 weeks of pregnancy. Our medical abortions, which are done with medications, mifepristone and misoprostol, are available to women who are from 4 to 9 weeks of pregnancy. We have always have a counselor on site when we're doing abortion services to be available to women as an option. Some women do have to go see the counselor if they have a history of psychiatric care, or if they indicated to any of our staff that they have any concerns or questions or doubts about their procedure. We do not do abortions on women who don't want them. And so if any of us see any kind of indication that there might be some indecision in that particular individual, we send that person to the counselor, and if the counselor confirms that, the woman gets sent home. Sometimes we encounter teenagers who have been pressured to terminate a pregnancy by their parents. We don't, once they tell us that, we do not do the procedure. We actually tell them how to survive if their parents kick them out of the house. We also encounter women who, as a result of birth control sabotage in a domestic violence situation, or who are being forced to come in by their partner, we work with them to make sure that they are safe and that it's not disclosed to their partner or husband that they didn't have a termination, and we try to give them some information in case they need to go to a domestic violence shelter. The service is staffed by physicians who provide all of the procedures, and certified registered nurse anesthetists in the event that the patient elects to have sedation, and nurses and medical assistants, and also the counselor. There were years when we only had docs coming in from out of state. We had to fly them in because we did not have access to any local physicians. And often in localities, the reason for that is because doctors get stalked. They put up wanted posters to target them. They go to their homes. There are doctors who have to, and I'm not talking about our facility, there are doctors in the country who have to travel with disguises, on wigs, and carry guns for their own safety. West Virginia, like many states, has placed restrictions on abortion access, and that was because in 1992, an additional court case allowed states to place restrictions on abortions as long as the restrictions didn't pose an undue burden. Well, as you can see in the current times, there are a lot of restrictions being enacted, and they seem to be causing an undue burden, but they continue to happen. In West Virginia, we have what's called the Women's Right to Know Act. This was the product of an anti-choice legislature and anti-choice activists. It requires that women who seek an abortion have to listen to a biased counseling script which talks to them about the fact that the father in the pregnancy is responsible to provide child support, the risks of abortion and the risks of carrying a pregnancy to term. It also requires, and this is something that the facility, Women's Health Center, has to provide to patients. It can be done over the phone, but we had to hire a licensed medical professional to be available every day we're open to provide this biased counseling script to women. And they have to receive that at least 24 hours before their abortion procedure. So if they don't receive this information, they can't have the determination. One of the objectives of these laws is to cause us a lot of additional expense and a lot of paperwork, so that if we slip sometime and didn't document something accurately, we can be called on the carpet. In addition to the biased counseling and the 24-hour waiting period, there is, they've added to the Women's Right to Know Act an ultrasound bill. a provision. And that provision of the bill requires that if you provide an ultrasound, you have to offer the woman an opportunity to look at it. Well, we did that anyway before this provision of the law was enacted. However, that provision is designed to shame women because they have to sign a document certifying that they opted to see the ultrasound or not to see it. Then there's the parental notification law that was enacted in 1984, which requires that a physician notify the parents of a minor woman who comes to terminate pregnancy at least 72 hours before the appointment. And that's something we will not do, we have not done. The minors do have options if they choose not to inform their parents because they can't communicate with them. It could be incest. The minors have an opportunity to get a waiver from a physician, a doctor waiver letter, or to go before a judge and try to get a judicial waiver. And either the doctor or the judge would have determined in that minor's case that it's in her best interest that her parents not be notified, or that she's mature enough to make that decision on her own. Most minors, however, do come with their parents, and the parents sign consents for their care. It's interesting, too, that we often have women who are anti-abortion come in to have an abortion because their case is different. We do well-woman gynecology, and what that means is if the woman has an identified problem, we don't deal with that at Women's Health Center. We would refer them to a specialist. But basically, women can come for their initial and annual gynecological care, examinations, breast exams, pap smears. We do STD diagnosis and treatment, birth control education, provide birth control supplies, pregnancy tests, ultrasounds, colposcopies, and a colposcopy is, we use a special machine that magnifies the area that was identified in a pap smear where there was some inflammation, and they can look at it with it's a magnifying function, and they can also take a biopsy of that area. We do referrals for sterilization, and we have emergency contraception, and we sell it basically at cost, which is around $20, because otherwise it's hard to get to locate at some drugstores, and it's expensive. It costs about $60 there, I understand. We also provide long-acting reversible contraception, which are IUDs, and the Implanon and Nexplanon that goes in the arm, the implant. Our service providers for the gynecological services are basically nurse practitioners who are specialists in GYN services. Most of our gynecology is provided through the Title X, which is the federal program, you've heard of Title X, family planning program. And what family planning offers is a sliding fee scale. So some women come to our office and they're able to get services free of charge because based on their income and family size, they're eligible for free services. They only have to be also interested in a method of birth control or seeking pregnancy. So either way, they would be eligible for that program if they're income eligible. And family planning is available to men too. We just don't provide that at our facility. Family planning basically was designed, that program was designed to serve uninsured women. And with the Affordable Care Act, there should be fewer of those, but we still get a pretty great volume of patients. We serve about 2,500 patients in the family planning program every year, and with about 5,000 visits. And that program is a federal program that is channeled through the state, and in the state, contracts are made with particular facilities, and we've had a state contract for family planning for many years. Minors are able to come to us for family planning services, and they're confidential. They don't have to use their parents' insurance if they have it, and the parents do not have access to the information about their care. Women's Health Center is the largest family planning provider in the state of West Virginia. We serve the most women and most teens. And 90% of our patients in the family planning program report incomes of less than 90%, 90% less than 100% of poverty. Most of these patients need birth control between the ages of 18 and 34, and they receive their birth control supplies free with their visit. The program that I call a companion program to family planning is called the regular routine gynecological care, breast exams, pap smears. It also adds mammography for women of the age of eligibility and the colposcopy that I described earlier. But a second component of the BCCSP program is what's called Wise Woman, and that program focuses on heart disease prevention. Heart disease is one of the prime killers of women. So at our facility, we provide a survey to each patient who comes in for her initial or an annual exam, whether she's breast and cervical cancer screening or not, so that they can have an awareness of the fact that they need to be alert to signs of heart disease risk. And it describes, we give out information that discusses that. The Wise Woman program offers lipid testing to women who enroll in breast and cervical cancer screening. And if their risk is deemed to be high, they are given follow-up counseling on lifestyle interventions such as exercise and healthy eating. We also operate a Right from the Start program, which is another state contracted program. And the Right from the Start program provides pregnancy support, education services in the home. It's a home visitation program for high-risk Medicaid-eligible women who are pregnant and their infants. The infants are enrolled in the program, and the pregnant women on referrals from their obstetrician or pediatrician. They do an assessment and determine the level of risk for those women. And the risk could be environmental, they could be in an abusive situation, or it could be a medical situation, or a combination of both that gets them into the program. Women's Health Center serves Kanawha County in this program. So we have case managers who are licensed social workers with bachelors in social work, who go into the homes of these high-risk women or into the homes of the women with infants. And they provide education to them on topics like how to take care of an infant, how to have a healthy pregnancy. They do smoking cessation activities with these women because West Virginia has a very high smoking rate during pregnancy. They provide emotional support because a lot of these women have no family support. They don't have a partner to go through the pregnancy with them. So the social worker becomes that support for them. They work with the clients to help them to identify resources. Many of these women have no supplies for the infant that they're about to deliver. They may have their utilities turned off, and so we also can work collaboratively with social service agencies such as Mountain Mission, Covenant House, or Heart and Hand to try to get the supplies and resources that these clients need. We had an incident to give you an example of how important these contacts with the case manager are for some of our clients. We had a social worker who had a client in Clendenin who lived a 5 to 10 minute drive from the main road. And it was time for the case manager to go in and visit because they are required to make a certain number of visits a month. And she went in and the baby was asleep, but she said, I'd like to hold her, but she really wanted to open her eyes. So the mom brings the baby over to the case manager, and the baby woke up and opened her eyes, and they were yellow, where she was jaundiced. So the case manager said, you've got to get this baby to the doctor now. So she was trying to help her brainstorm how to get this done, and she did that, took the woman to the doctor's office, who immediately had the baby admitted to Women and Children's Hospital. A day or so later, the social worker got a phone call from the mom, and she asked the social worker, could she please come to the hospital, because she wanted her to be with her to help her understand the medical information that was being given to her about the situation of the baby. So they do provide a lot of support to these clients. They become very close to them. The other thing that we encounter in the Right from the Start program is that so many of the clients do not have access to transportation. We serve the housing projects in Charleston, but also, as in Clendon, and people who live out away from bus transportation. This client had Medicaid, of course, because she's in the program, but there was no taxi service that would accept the Medicaid voucher for transportation. So what we do when we apply for grants, we ask for money for bus tickets, so the social workers can issue bus tickets to the clients so they can get to their medical appointments or to their well child checks. The infants who are enrolled in the program are at risk for death during their first year of life, so the case managers are always in those homes when they're meant to be on schedule to check to make sure that those babies are thriving, that they're fed well, and that they're meeting their developmental milestones. The other things that we do at Women's Health Center include reproductive health education. We will go out into the schools and colleges or community groups at no charge to provide information on reproductive health education. But unfortunately, in Kanawha County schools, where we used to get frequent requests for speakers, there have been very few in recent years. We also advocate for access to reproductive choice, so that's part of our mission, and our board of directors does a lot of that, along with West Virginia Free, who is the lobbying organization. We have we're governed by a volunteer board of directors, local individuals, and we operate with a small operation. We've got the executive director, me, secretary, a biller, office manager, and about 6 medical assistants who are cross-trained to be receptionists, what we call telephone counselors, who make appointments and talk to patients, and then the medical assistants who work in the clinical division. We also have nurses, LPNs, and nurse practitioners. Our revenue sources are grants, fees for our services, and donations. So we do have an active fundraising committee who tries to come up with methods to raise funds to support our operating budget. And typically every year we've been able to get what's called Neighborhood Investment Program tax credits from the state of West Virginia, and you have to apply for that. And those credits go to donors who donate at least $500 at one time. And Women's Health Center does accept most insurances. We accept Medicaid and Medicare as well. We're affiliated with the National Abortion Federation, the Feminist Abortion Network, the Partners in Health Network, which is affiliated with CAMC, the West Virginia Primary Care Association, and the National Family Planning and Reproductive Health Association. We also we collaborate with local nonprofits such as the YWCA, West Virginia Free, as I mentioned before. And we administer, actually, for West Virginia Free, their Choice Fund, which is a fund that is available to women who have to travel out of state for abortion care and who don't have money and, of course, aren't able to use their medical cards. One of the things that we are dealing with right now is a crisis pregnancy center that has moved in next door to us. And the tactics that crisis pregnancy centers use is to deceive women and to move in next to a reproductive health center to try to confuse women to come into their facility instead of ours. Crisis pregnancy centers are facilities that are staffed by volunteers who are typically affiliated with a religious organization. They do not believe in birth control, nor do they believe in abortion services. The one next door to us is called Woman's Choice. They changed their name, which is part of their plan, to try to confuse, because their name up until that point was Lifeline of Charleston. The anti-choice movement is a threat to women's health, as are the many anti-choice laws that are being passed. Texas is notorious. You've probably all heard about the laws in Texas that are closing reproductive health facilities that provide abortions and the other range of services that I've discussed today. The outcome of that kind of thing, which is, again, a risk to women's health, is the fact that if all the facilities that provide legal, safe abortions were to close, we would go back to the days of the abortion wars, which many people have forgotten or didn't know about, where women who were desperate before abortion was legalized, they tried to self-abort. They would use things like Drano, coat hangers. And I want to read an excerpt. Which I forgot to take it from This is a book, and just an excerpt from it is what I'm going to share with you, from Susan Wigland. And we brought her in a couple years ago to speak about her experience as an abortion provider. But the title of the book is called This Common Secret. And the section that I'm going to read to you, so that we hopefully will never go back to the future, but this is the discussion that sort of explains why she became an abortion provider. She was on her way to her grandmother's. When I drove into Grandma's driveway, I could think about how she would react. I had started out to tell her many times over the last few years, on so many visits, I had meant to have that conversation, but had never found a way. Something had always intervened. Some other errand had always come up. I had found a way not to face her judgment. It didn't matter that I was rock solid in my resolve and in my chosen profession. This was my grandma. It was in February of 1992, a Saturday afternoon. The next day, the 60-minute segment I'd done with Leslie Stahl would air. Grandma never missed 60 minutes. I had to tell her before she saw it. Before she saw her oldest granddaughter talking about the death threats and stalking and personal harassment my family and I were enduring. I wasn't at all ashamed of my career. In fact, I always considered it an honor to be involved in reproductive choices, the most personal and intimate realm for women. I just never felt the need to make it public. Very few of my family and friends were aware of what I did. I felt myself sweating under my coat. I had to reveal something to my dear grandma that could change everything she believed and loved about me. I think she sensed that I had come to talk about something important. I started talking a few times about the other inconsequential things, then finally I plunged in. Grandma, you know I work as a doctor. Of course, and we're all so proud of you. Yes, but I don't think you know the whole story. I'm a doctor who works mostly for women, helping women with pregnancy problems. Grandma hesitated just a second. When after a moment, she stared straight ahead and started to speak, slowly, deliberately, in a very quiet voice. At the same time she began stroking my hand, it was as if the gentle stroking was pushing her to talk. And Grandma said, when I was 16 years old, my best friend got pregnant. A chill went through me. I always believed it was her father that was using her, she went on, but I never knew for sure. She came to my sister Violet and me and asked us to help her. While I listened, thoughts whirled through my head, stories I had read of women self-aborting and dying of infections when a safe legal option was not available. The women who came to the clinics where I worked, many of whom had to overcome huge difficulties to end an unwanted pregnancy. It isn't uncommon to have patients confide in me that prior to coming for an abortion, they had used combinations of herbs to try to force a miscarriage. These home remedies can be extremely dangerous and have caused the deaths of many women. Grandma goes on. The three of us were so naive. We knew very little about these things. But we had heard that if you put something long and sharp up there in the private place, sometimes it would end the pregnancy. We closed ourselves, the three of us, in one of the bedrooms late one morning. We didn't talk much, and she didn't ever cry out in pain. It took a few tries to make the blood come. None of us spoke. We didn't know what to expect next or what to do when the blood kept coming. It was all over the sheets, all over us. So bright red, it was awful. It just wouldn't stop. We put rags inside of her to stop the bleeding, but they soaked full. We all three stayed in the bed. We just didn't know what to do. We stayed there together, unable to move, even after she was dead. Her father found us, three of us, in the bed. He stood in the doorway staring. No words for a long time. When he did speak, he told my sister and me to leave, and that we were never, ever to speak of this. That was 72 years ago. You are the first person I've ever told that story. I'm still so ashamed of what happened. We were just so young and scared. We didn't know anything. Grandma sighed and held my hand tight. Tears welled in her eyes. I know exactly what kind of work you do, and it is a good thing. People like you do it safely, so that people like me don't murder their best friends. I told you how proud I am of you and what you do, and I meant it. And on that note, I'll close.